Welcome back to our English weekly class. So, this time I would like to reinforce or talk about the common breast problems, thinking about October and thinking about what we are celebrating this day. What we celebrate last October the 19th, celebrating the day of the breast cancer awareness month, thinking about how many women has died because we are avoiding the early diagnosis for uh, breast cancer. So I hope this can reinforce our knowledge about the breast cancer and making us thinking about a very early diagnosis of cancer, breast cancer. And we're going to review some facts about the cancer in Mexico. And I would like to thank my friend doctor, this Dr. Diana Flores. She's a specialist in breast cancer, and she works in the Department of Oncology in the INCAN. Thank you. So, breast cancer, as we know, it's one of the most common causes of non-cutaneous cancer, and as we can see these numbers, it's the first. It takes the first place in women's cancer, and every day we will be having new cases. As we can see, 39.5 over 100,000 population, and of course 20 more than 27,000 cases every year. The thing about this cancer is the mortality. It's a little bit high, like 9.9 for every 100,000 population people, and of course the death rate it's about 8.2% every year, as we can see in this data source from 2080. So this is, as we said, the most commonly cancer in women, and will be the second cause of cancer, all kind of cancers. So it's a very important number. Talking about Mexico, we have these breast cancer rates, and as we can see, our incidence it's about 27.2%. Our mortality rate it's about 10%, and the lethality goes up to 0.37%. Okay. And now, well, let's talk a little bit about which are the most common signs and symptoms in breast problems. Mostly, we will find these palpable breast masses, mastalgia, and the nipple discharge. These are the most common, but of course, we will be thinking about some other signs and symptoms. Let's take a look. When we talk about these palpable breast masses, we know that they are associated with increased risks of breast cancer. We can just sometimes these masses are very small, so we cannot find it. But when we see these kind of masses that even at the minimum movement from our chest, then we can find the mass. And when we take the ultrasound, the mammograph, or the CT scans, we can figure out how big is this mass or how deep it is. And also, we must remember it's not only women that will have these palpable breast masses, but also male can have. We can see on the ultrasound and in the mastography all those masses, but we must be beware that the size of the mass could be really, really small, so we cannot pulp. Okay. Of course, when we have this palpable breast mass, we should evaluate a very detailed history. We must do our clinical breast examination or CBE, and we must ask for imaging for all women. As we can see in the first part, this in a mammogram or a mastography, we can see the cancerous mass as a bright and irregular image that will have the spiky or fuzzy edges. It's not totally round, as we can see. If we are talking about the ultrasound, then this cancerous mass could appear a little bit darker, indicating that the container of this kiss will be solid, but it also can have spiky or irregular edges, as we saw in the mastography. If we are using a MRI, these contrast agents could help us to see the brighten and irregular spiky borders in the of the mass. And finally, when we get the biopsy, we can see that these cancer cells may apply clustered. They will have irregular rash or additional nuclei, and it could be invading those blood vessels or the lymphatic vessels. Of course, we said we must look for those palpable breast masses in all women, but just remember, men can also have breast cancer. Of course, it's not as important the number of men with the breast cancer, but it's very important for us thinking about men can also be suffering from breast cancer. The second symptom in breast cancer it's mastalgia, which means it's the pain that it's involving all the the sound of the mama, and we can account them for 2/3 of all the breast pain cases, and it's very pretty common in women on their 20s and 30s. As we talk about mastalgia, we must evaluate the breast pain, and we must ask the history about this pain. It means the location, how it is pain, the quality, the severity, laterality, and also the temporal relation to menses or period. We also must ask our patient about any medication history, if she has any musculoskeletal triggers. Of course, their activity, daily activity, and of course, very important, if there's any familiar story of breast cancer. The third symptom that we are going to look for is the nipple discharge. This is a common symptom among women of the reproductive age. At least once in a life, these women will be experiencing this nipple discharge. Most of the time, this discharge is physiologic or it's due to the benign etiology, but we can find an underlying malignancy in up to 21% of those patients that are presenting this pathologic discharge, and then that those patients who undergo a biopsy. For this nipple discharge, we include a comprehensive history and physical examination, looking for any leakage of the nipple, As we can see, we can find milk, we can have find blood, different kind of leakage. But our primary aim will be to distinguish between a normal lactation or non-purpural galactorrhea and a real pathologic discharge. Thinking about the classification of the discharge, we can see the two major classifications. Talking about physiologic discharge and pathologic discharge. Of course, if we have a physiologic discharge, we could think about if this discharge is due to a compression, if it's bilateral, it has multiple ducts, and if, for example, we have people who make a lot of exercise, aerobic exercise, we can think about this discharge. If there's extensive manipulation, if we are under stress, and of course, if we are, if the woman is under a pregnancy. The difference between the pathologic discharge is that it is spontaneous. Most of the time, it's unilateral. It will be in only single duct, and most of the time will be we will have the presence of blood in this leakage. The diagnosis for this pathologic discharge could include intraductal papillomatosis, ectasia, or intraductal mastitis, or even the worst, a cancer. Okay, if we classify this nipple discharge as pathologic, we will think, as we said, it's spontaneous, it's bloody, it's unilateral, or can be associated with a breast mass, as we can see on the picture. And of course, we have to make the difference if our patient is pregnant or it's in doing a lot of exercise, but also if there's no any chance of being physiological nipple discharge, then think always about the possibility of abnormal cause such as cancer or breast cancer or ectasia. As we notice, galactorrhea is one of the most common causes of physiologic discharge, and of course is not associated with pregnancy or lactation. It will be the result of an endocrinopathy, such as hyperprolactinemia, or even the dysfunction of the thyroid. Or it can also be the result of the use of dopamine inhibiting medication. Okay, so we must be sure if it is unilateral, if it's a single duct, if it's bloody or serosanguineous, or associated with a breast mass. We must look at the difference and see how evaluation for a breast tumor could be different or not related to galactorrhea. In these patients with a pathologic discharge, we should go into diagnostic by imagining like mastography or ultrasound or CT scan or even an MRI, looking for the source of this leakage. Talking about these common breast problems, we can also talk about these fibroadenomas, as we can see in this mastography. This is a female of 72 years old with a history of a colorectal cancer, and she was also having a palpable breast mass. And as we can see on the mastography, we see an oval mass in the retroareolar region. The ultrasound is showing us an hypoechoic mass, which has an internal vascularity of the pulpal abnormality, and the CT shows 3 centimeters right breast mass. And after they had the biopsy, they find out there was a fibroadenoma with ducts that are compressed and along by an expanded hypocellular and elyseal stroma and a tibia. Okay, talking about the benign masses, this is more probably to be smaller, mobile, smooth, and regular when we talk about the benign masses. And the difference with the malignant masses are these masses are typically larger, fixed, hard, and heterogeneous in the texture. If we find out we have a mass, then we should include the size of the mass, the consistency, the distance from the areolar edge, and of course the circumferential position on the breast. It's important for us to point exactly the location. And of course all the things around the skin and the pigmentation, if we have the inversion of the nipple, any change on the skin or change in the size. And just remember, sometimes in the countryside, many women used to breastfeeding with only one in only one part. So it's also for us important to ask if they are breastfeeding their child, if they only use one of the cells or both of them. When we talk about the mammography or mastography, we say this is the most appropriate initial imaging modality for women 4 years old and older that will have breast mass. It's important to see the different classification about the masses and the accuracy of this mammography. It's as high as 78%. Also, ultrasonography is recommended for women that are younger than 30 years old. And we also can use an MRI to screen breast cancer. Okay, when we are evaluating these masses, we have like three main purposes. The first one is for us to evaluate the mass. If we can see the difference between a normal cyst or a calcification, or just talking about real breast cancer. Secondly, we will be looking for any additional abnormalities in the breast. Okay. And the third one, we must be considering a guide biopsy so we can find out whether it is a cancer or whether it is not. Okay, now talking about this diminution of the mortality in the countries which has a good budget for these cancer issues, we can find out that in those countries in Europe, they are having low rates comparing from 2012, 2014, and now actually for 2019, and we can see how they are going down on the numbers. The thing about these countries is that, as I told you before, the budgets for them it's high. Unfortunately, in our country, it's not. We don't have that kind of budget, and of course, women with less chances of having a good scanning for their masses, they might not have been that lucky. As we can see, this is kind of an example of how the supervivience or how women can face cancer. It's something similar to the Titanic. This is an example that Dr. Diana Flores, the oncologist from Lincoln, is giving us an example. people that will have a first class ticket will be in the better opportunity to survive, because they will have more chances to go through the through the sickness. So people in those developing countries with no very good budget for studying their masses will have less chance to survive. It's just like a similitude, talking about how we can survive against the breast cancer. Okay, so this is a very small review. As I told you, this is something like celebrating the October, this month, when we insist and when we teach our patients how to take auto self examination of the breast. Just always remembering that we should have this. Every year we should be under the supervision of a professional in order to avoid the risk of getting cancer. Because as we saw at the beginning, breast cancer is still a very high rate of mortality, and it's very easy for us to find out whether if we have any mass on the breast. We should go under supervision. So thank you, and please just remember, we must, if we are women, we for sure should be taking care of us and having our examination, but we should never forget that men as well can be suffering from breast cancer. Bye.